So first we're going to do the PowerPoint, and then we'll do the skills, and then I'm going to come around and check your assignments, and then today we're also going to review for the test that we're having on Tuesday. Okay, I'm going to go over some things with you that you should be preparing yourself for. They're not like junior year, they are harder tests.
She's talking.
You, ma'am. Thank you. So, and then I have one packet for you, and we're going to do vocab F through I.
When is F through I due?
F through I will be due next Friday. Right, so I'm going to give you a week, and I'll keep adding every time. So we'll go over that again at the end. But in your notes, we are on the fire section, which is page 63, I believe, right? Something like that. So, in case of a fire, we talked about a little bit of this yesterday because 63, right? Things that cause fires. So we have electrical things. Anything that's electrical can cause a fire. If we plug in frayed cords, those can be cause a fire. Throwing away the wrong trash in the wrong area can cause fire sometimes. Smoking is the #1 reason for a fire to happen. Huh?
And skip past 66.
You gotta go past 66.
They're just in order, funky. That's it's the way we do them. I don't know.
If you get to page 66, you go to the next one and do
So examples of our fire hazards, right? I told you yesterday the oxygen could be a fire. Anything electrical, like the electrical razors, the smoking is the big thing. Matches. So how do we prevent them? Everyone has to be enforcing that there's no smoking in the rooms. Everyone has to be on top of that you're transferring oxygen the way you're supposed to and not using equipment inappropriately and checking cords. All of those things are everyone's job. If an outlet looks like it's not workable, it's probably not workable, so don't plug something into it. If the cord looks bad or something's broken, like a prong, all of that can be fire hazard, so you're not supposed to use those things either. So it's all of our jobs to do that. A big thing that can cause a fire is overloading it. So plugging in one thing, like the power strips, and then plugging in 10 different things, that is a huge fire hazard. We all do it, but it's a huge fire hazard. So not something not to do in the nursing home. The oxygen can be a big thing. I told you how it can cause a spark when you turn on the electrical razor yesterday. So make sure that you're not using those when they have oxygen.
Do I want it?
And a big thing is practicing fire drills. So staff should know where to go and what to do when there is a fire. So if there's a fire here, do you all know what to do?
Yeah.
You exit the building, right? So the same thing, a teacher's job is to take a head count and know where all of her students are, or know where they're at in the building, so that if there is a fire, I can account for you and find a firefighter to go get you. So same thing in the nursing home, you need to know that for your residents. Things that the 3 things a fire needs: fuel, heat, and oxygen. If you're in a nursing home, they have an emergency fire plan, just like our school does, ways that the people are supposed to get out. We talked about it yesterday about who should go first. It would be people that walk, and then people in wheelchairs, and then people in the beds. And if there is a fire, we follow RACE. Remember RACE from last year?
I never learned that.
R is rescuing your residents. A is activating the alarm. C is containing the fire. And E is extinguishing it or evacuating.
Wait, what's the one for the fire thing?
That's past. That's next.
What? I remember that one.
Okay. We never use elevators if there's a fire. And we evacuate ambulatory patients first. So if a fire happens, we do the RACE. We talked about that. And we don't block hallways. The doors that close automatically are considered fire doors. So they just close right away when a fire alarm goes off, and then they're a barrier to the fire. They're usually thicker doors, and the fire can't get through them. We use the sprinkler systems, we use the pool boxes. What else is there that they do in fire, right? Then we have fire extinguishers, and today you are gonna get the fire extinguisher out, like we did last year, and you're gonna tell me pass, and you're gonna do it. So P, pull the trigger, or pull the pin. A, aim it towards the base of the fire. S, squeeze the handle,
Sweep.
and then sweep back and forth, right, to get the fire out. That is pass, and that is what we will do with our fire extinguisher when we do the skill. I think we're good there. So the next standard is body mechanics. If you guys kind of remember that from last year, we talked about how to bend, how to move yourself, how to keep yourself safe with your patient. So the definition of it, it's a technique to prevent injury for you and for the people you're working with. It's your employer's job to teach you all the things you need to know about the safety, and it's your job to follow those steps. So body mechanics, right, it's to prevent fatigue and injury. We want to use our largest muscles. So our leg muscles are larger than our back muscles. So you want to do everything with your legs, not your back. Your feet should be shoulder width apart at the base so that you have a good standing support. Anything that you're going to carry should be close to your body, not far away. Not like, woo, really far, right? It should be super close. We try to push rather than pull because it's easier to push with your muscles than it is to pull them towards you. You can strain yourself more.
Who highlighted in here? Like this is copy off of?
Me?
Oh, you?
Why?
Just wondering.
She highlighted things that she thought were important.
Well, I
Isn't
had
that
to
what
go
you
through the course and learn how to, they tell you things they're supposed to tell you, so we took notes, and I just highlighted my notes instead of took the notes, and then I realized this was the only set of notes they were giving me. So, you guys got right notes on it. You can see my chapters are wrote on it, because I decided what chapter they were in the book too, so. We don't twist. You don't want to twist when you're bending, right, because you can pull a muscle. If you need help, get help. Work together. We're going to pull someone up in bed again today, like we did last year, and you have to do it on 3, right? You're going to do it together. Use a lift if you need one. If we get to go to the nursing home this year, which I'm really hoping we do, there are lifts that they will show you how to use. It's the next picture.
What nursing home do we go to?
Well,
My mom said Shawnee Manor is accepting students. She knows
high
that.
school students.
Oh, I don't know about that. She just said students because her friend's teaching there.
Yeah. So, Lyman Manor is normally where we go. I called them last week and they got back with me. They are declining high school students right now. They're not letting us in. So we have a backup nursing home, which is Springview. I have a call out to them. And then if not, our third nursing home is Shawnee Manor. But a lot of people I think are refusing because we're high schoolers.
I thought we go to that Liberty place.
That was for adopted grandparent. I have lots of nursing homes I could call, but we have to have a signed contract with them, and I only have contracts with 3 nursing homes right now technically for this part of it. So we'll see what happens. We've never been declined entry into a nursing home in like 25 years.
That's a good thing.
Yeah, and we've only been declined because of COVID. So
We got a whole, did I tell you we have like a COVID hallway?
yeah, everyone has a COVID hallway, I think.
Like,
Yeah.
it's like all like sealed off.
Yeah, so I believe that. We use our gate belts when we lift someone, right? So to move a resident, this is kind of basically what you should do, right? You're gonna tell them what you're gonna do. You're gonna get something underneath them to pull them up with. You're gonna lock the bed, elevate it to your level. You guys know all of these things. Resident safety, we're gonna do that. We will talk about transfers at another time, and we'll start transferring the patient from the bed to the chair to the bed. Those are skills still.
We did that already.
Yep. You still need to make sure your patient's in good alignment, and good alignment is that their spine is in line with their head, so they need to be straight in the bed. These are our good alignment patients, right?
So wait, good alignment is what?
When your spine is in line with your head, not like crooked and that kind of stuff, but together. So we need to say, we want our patient to be in good alignment so they're comfortable, so they don't pull any muscles, they don't strain. The big thing is that we don't want them to get any skin breakdowns, right? You don't want them to have any pressure ulcers. These are the terms you need to know for your test. You have to know what supine position means. That means on their spine, they're on their back, they're face up. You have to know prone is on their belly. They're belly down, they're face down. Lateral position means on their side. Fowler's position means they're sitting in bed or they're sitting up in a chair. And basically sitting position. It's going to ask you, your patient is choking, what position should you put them in?
Fowler's?
Fowler's position, you want them to sit up, right? What if it says, your patient is they're turning on their side, what position should they be on? Navaris?
Let me ask me again. I already answered one. But you said what though?
I really just wrote these just to see they're right there.
I just highlighted them and put an arrow to very important.
So, Fowler's
How did I not
position
see
is
that?
sitting, they'd be in their lateral if they're on their side, right? Lateral position. It also, another time, asks them, what did they tell me last year? It asks something about, their patient was on their back, what position would they be in? And they
Which
didn't.
one's most important?
Basically, supine,
All of them. She said
prone.
these are what we need to know for the, like, they're really important
You're
for the
gonna
test.
need to know these
I thought
ones
you
are
meant
the
there was
most
just one.
important.
I read the whole thing.
Take a picture, write them down. They should be in your binder somewhere, but I don't know where they're at right now. Are they in the binder?
Yeah, they're right here on page 71.
On page 71, they're in
After I
there.
already wrote them, found them.
Okay.
It's fine. Not mad.
So correct body alignment, right? These are the pictures of them being in those positions.
I sleep like that one.
Fowler's.
Do you really?
Fowler's really has 3 positions, low, medium, and high. Basically putting them in a sitting position. We're gonna do all of these skills. We're gonna move them up in bed today. Moving
move
side
you
to
up?
side, we're gonna learn that when we turn them on their side. That's a skill we'll do. So our last section today is about restraints, okay? Restraints are a last resort. Nursing homes don't even like to use restraints. In fact, I don't even think they use them anymore. Like, I can't remember the last time a nursing home actually used restraints. The hospital, the hospital doesn't use them hardly at all anymore either, unless you're violent, like you're swinging at us and you're just a violent patient or you're an inmate. Those are the only times I can think of we use restraints anymore there. The nursing homes are a little different. So they consider a restraint anything that keeps them away from people, right? Anything that's prohibiting them to do something. So in the hospital, we put the bed rails up for everybody. And in a nursing home, when the bed goes up, the side rails go up. When the bed goes down, the side rails go down. So they don't need side rails up when you leave their room. In fact, a lot of nursing homes have taken off the side rails in their beds. So even when they go up, there's no side rail, because those are considered a restraint in a nursing home. They used to not be, now they are. There are chairs, and I've got one in the back corner. You can't really see it. It's that blue one that's got that tray that sits on top of it. That's considered a restraint if the tray is in front of them with no food on it, because they can't get up. That chair also lays back into a recliner. That's considered a restraint if they cannot get themselves out of that recliner.
So
you
basically,
can't-
if they cannot move themselves with restraint,
they cannot move themselves, you are restraining them. So we try and get them, you try and do other things to not restrain me. If I'm bugging you, if I'm constantly on my call light, like I think Anna asked last week, like what if they just keep putting on their call light? What do? You have to find something else to entertain them with. So there are people who want something to do with their hands. Get them a coloring book, getting them a word search, get them some towels to fold, put them in a wheelchair, pull them around with you all day. Get them up and go for a walk. Take them to the bathroom. Get them a puzzle. Can you guys think of anything you should do with them? How you gonna make them go to sleep?
When I was at work, they was throwing beanbags.
Throw bean bags, right? Go to the activities person and ask them, what is there to do for this patient? They need something to do. Because I would rather them do something, an activity, versus trying to
Annoy you all day.
annoy me all day and put them in a restraint, right? So we always have to keep them safe. That's the big thing. The reason we don't like using restraints anymore is because people would try and get out of them, and there's a rope on them, obviously, and they would hang themselves. And then we would have a patient, we've had too many patients die while in restraints, so they're not allowed to, they don't use them anymore.
So how are the side rails restrained?
Because they can't get out of the bed without having them without moving them.
And they can't move on their own, can
They
they?
can't move on there. I mean, they can get out of the bed, but then they'd have to go around that side rail, and that would be in the way. That's what's considered a restraint. And there are some side rails that go up like the whole length of the bed. So those are definitely restraints, because you can't get out. The resident has the right to be free from any physical or chemical restraint. So drugs can be considered a chemical restraint. So if you're having pain and I give you pain medicine, that's one thing. But if you're not having pain and I still give you the pain medicine and I like loop you to where like you're not coherent, that's a chemical restraint.
What do I know that Elijah part of last year, but
I don't know what that is, but they probably did. They put something in there, they gave him a chemical restraint. Yeah. Who else said something over here?
what if somebody lied and said like they hurt him but they not using something?
Well, if they reported they're having pain and you gave them, then you did what you were supposed to. It's when they don't report anything and you give them a pain medicine that you're in trouble. So, restraints are used as a last resort. That's the last thing, right? You'll have to keep remembering that. There is a question, there's a couple questions on the state test that asks about like, when should you put restraints on? Well, restraints are a last resort, and they're after you've exhausted all of your other options, you can use a restraint. If somebody does have restraints on, like let's say we've done everything we can and now we need to put them on, and on Tuesday we will learn how to put them on, but let's say we've done everything. You have to still check circulation. If you put it on their arms or their legs, you still have to make sure they're not too tight. And then every 2 hours, you have to come and take them off and check your arms and your legs for skin breakdown and all of that stuff. And you should check on them about every half an hour to make sure they're still breathing in the restraint, because anything could happen. Yes.
What is it fire look? Fire. This from a year ago.
We'll look at it and try and fix it.
That's you in my picture.
Oh.
It's on page 7.
He said, oh.
I'll have to look at it. I had help.
Page
I had help
7.
putting them together.
We on page 7.
But it's not up at the
But it's
front.
not
It's like in the
front,
middle.
It's in the middle.
This one?
Yeah.
It-
Page 7. It should be somewhere in the middle. It should be after page 74. Yeah, all of them.
Okay. So it's all messed up. We'll fix it. I'll help you fix it after we're done. So how do you know if an extremity is not getting good blood flow?
It turns color.
It turns color, their hand is numb, it's tingly, they're having pain, there's no pulse in it. Those are all bad signs. It's cold. If they're respiratory, the same thing. Their lips are turning blue, they're having troubles breathing, they don't
Yeah.
feel good.
Alright, where we at, Mrs. O?
Should all be in there with restraints.
We're struggling.
So you can get over. I don't know what happened there. We have to offer them fluids when we take off their restraints. You have to check their limbs
it's on
every
the-
2
go back to the
hours.
first
Every
page.
hour you check on them. We'll go over the types of restraints when we use them, but these are what I'm saying about restraints. Side rails, how this is the whole bed, and then this is the chair with the meal tray over it, but there's no meal over it, it's just tissues. That's considered a restraint. You can use a seat belt, they used to. There's the mitten, so they don't scratch themselves. There's the limb restraint, which we'll practice with, and the vest restraint we'll practice with. and then we'll go over those skills when we do them. Does anybody have any questions about those 3 topics?